Hello, I'm Nicholas Torres. I am the Executive Director of the Network Towards Unity for Health, TUFH. TUFH aspires to achieve its vision for local adoption and implementation on social accountability, interprofessional education, collaborative care, and health workers' competency standards. To do this, TUFH is establishing national or regional collaborating centers of excellence. A national collaborating center of excellence is an extension of TUFH within a region or country that serves as an independent chapter of TUFH. Each National Collaborating Center of Excellence will be provided a TUFH license and technical tools, including, but not limited to, the Social Accountability and Interprofessional Education and Collaborative Care Institutional Self-Assessment and Verification Tool, 2, TUFH Leadership, Faculty and Student Academies, and 3, TUFH Communities of Practice, including health workforce standards and courses for Indigenous, migrant and refugee, remote and rural, aging, intellectual development disabilities, and women's health. The goals of each National Collaborating Center of Excellence are that 15 to 20% of health professional education students will become socially accountable institutions defined by completing an institutional assessment and certification process, will become interprofessional collaborative institutions defined by completing an institutional assessment and certification process in interprofessional education. And 3, will incorporate standards of care for one or more health priority populations, including Indigenous, migrant or refugee, remote and rural, aging, IDD, and women's health. We hope and expect that each National Collaborating Center of Excellence will convene like-minded institutions within its respective country and lead the efforts towards health science education and health delivery systems to be adaptive and more responsive to people and society's needs. Each National Collaborating Center of Excellence will come together with other national centers of excellence across the globe to adapt and improve upon TUFH's technical tools, thereby improving all countries' health education delivery systems improve.